Welcome to Unraveling the Brain. I'm your host, Dr. Josh Matson. Today I got a great episode. We're going to talk with Dr. Brian Pickna. He is an MD out of Canada. Lots of great conversations today, and look forward to you guys checking out this episode.
Yeah, great. Thank you for having me on. It's been a pleasure to be here in Iowa. And
you're welcome.
Yeah,
man,
thanks.
It's big change from Canada. You know, talking with you, it's been we talked about a lot of different topics, but okay. So Brian, he took my last cohort of Unraveling the Brain, and let's chat about things that you learned in there that maybe you didn't know prior to, or that gave some bigger insight. And we can talk about maybe some cases you've started seeing since then, and maybe things you've implemented differently. So let's just start there and chat about that.
Yeah, I guess the biggest thing is like primitive reflexes, right? That's what you focus on. And in med school, never really heard that term specifically other than, oh yeah, you check for these reflexes that an infant has, like Morrow and Babinski and Palmer and you know, all the ones that we talk about. And, you know, those we just say, yeah, they're there and they go away, and they never really talk about what happens when they don't. Yeah. And otherwise, the big one is, you know, what we test on adults is the Babinski, and, oh, that's an upper motor neuron lesion, and you got to, you know, do these next sort of steps to find out why that's still present. Yeah. But all the other ones are pretty much lost and forgotten. Yeah. And I learned the same thing in school. I mean, I still remember my pediatric course and them talking about these reflexes, and they go away. And it was literally like a day, or not even, it was like 1-2 hour lecture, talked about that, they go away, and that's it. But I mean, like, as you've seen here, almost every kid that comes into our office with developmental challenges still has those reflexes. Mm-hmm. And children that you might not think anything, they don't have any struggles or any concerns, that might not be apparent to you, but to the parents, there's something else going on. And, you know, you can test these things and see that they actually are still there and work on them. They go away, and, you know, and your program kind of accelerates their recovery, or, whereas, you know, looking for other means, there's people that work in this field that it takes them many, many months and sometimes years for that to go away. And so it's quite remarkable what you've done with that. Yeah. And for people listening, honestly, it's not that we're doing anything crazy wild or out there, to be honest. Like, all these things have massive amounts of research behind them. They're easily to implement. Like, they're not hard. I mean, they're expensive to get the tools to do it, but once you have the right tools, it's easy. It's just as simple as getting them oxygen, getting them energy, and then rehabbing the reflexes. And it's crazy how fast they go away when you actually have the right tools. Like Dr. Lauren, he was just telling me he had a kid yesterday. They've been working on primitive reflex for a year, and his reflexes went away in the first 20 minutes of his session, just by getting the brain enough energy, activating the correct networks in the brain, and the brain can do its job, and it can inhibit these reflexes like they're supposed to be. You know, like what is naturally supposed to happen. But you know, in talking about that, I have my own perspectives on maybe why the brain isn't maturing efficiently, why it's not developing efficiently, and these reflexes going away. But maybe give some insight on maybe the things you learned in the medical system of why these delays might be happening in the first place, or anything in relation to that. The different thought processes there, because I'm sure there's differences we could talk about. Mm-hmm. Well, I would say, you know, no one's testing these primitive reflexes, are just ignored. And for lasers, we would never think, oh, we can use them on the brain, on the, you know, scalp to treat and have an effect on the brain. Yeah. And other people might think, oh, you're not going to do anything with that because the skull's just going to reflect all that, you know, photoradiation. But the, you know, other aspect is, oh, is it scary? Is there something that you're going to trigger? And really, it's very benign in terms of side effects. Yeah. So. Yeah, it's one of the most researched therapeutics unless the study was done horridly, to be honest, with way too high a power, way too long, there's really no studies that have any side effects. Mm-hmm. So, which is, I mean, like, what therapeutic strategy out there has positive benefits shown through thousands of research articles with relatively no side effects at all, or if any, for the last 70 years? Like, there's very few that I can think of therapeutic strategies that do that, which is kind of wild. And
And when you look at that body of research, I mean, it's huge for every brain condition. It's kind of wild.
Mm-hmm. Yeah, and like my first exposure to lasers was about 10, 15 years ago. I was struggling with headaches, and I had someone do laser acupuncture. So they had little probes, and they put them on multiple spots, and kind of looking at the acupuncture sort of philosophy.
System.
Yeah, and it worked really great.
Yeah.
And then when I went away to med school, and I wasn't able to get that therapy.
Yeah.
And then in the States, I was trying to look for someone doing that in around Detroit, where I was doing my residency, and couldn't find anyone specifically doing that sort of work. And then ended up actually getting something I think you're familiar with, prolotherapy.
Yeah.
You've heard of that, right?
Yep.
So that was some treatment I was getting for my headaches, and that worked too. But, it's the lasers I felt was safer.
Yeah.
You're not poking a needle into somebody. You're, not, having risk of infection, bleeding, and the pain of that. It's, very sort of non-invasive therapy that I think has so many, sort of options to do things for.
Yeah,
like that book that, or the sort of, what is it? The book that comes with the laser. The manual. The manual.
The big manual.
Yeah. Just looking through that, I was kind of astonished that all the different things that laser can be used for, not just pain and different types of ailments. So
yeah, we had a kid here last week that broke out in a herpes simplex virus on his face. It was getting bad fast. We violet lasers and red lasers, and within a day they were all healed over, and within a few days they were all gone, which is wild.
Yeah.
And we just had him, we sent one home with them while they were here to use a few times a day. And like just even simple infections like that, it's really remarkable what it can do.
Mm-hmm.
I was going to go point off of that. What was that? That's really interesting about your headaches though. What I was going to say is, like even with those acupuncture probes that come on those, like there's some really cool studies using, like 405 or violet light with those acupuncture points for kids that have autism that have it's been shown to improve speech and vocalization and behavioral regulation by using a lot of those acupuncture points, which is really interesting. Dr. Lord was actually just showing me, talking about some research today and some different acupuncture points along the head and different stuff like that, so there's definitely starting to get a lot more research out there, especially for kids with developmental issues and safety profiles. And again, it's the same thing. We're not finding any adverse reactions with them, which is huge. And that's a big portion for our practice, is making sure we're not implementing anything that does have a risk associated with it, right?
Yeah.
So,
and the benefit, I think, with laser acupuncture versus traditional acupuncture is the margin for error. It's like people train so long to do acupuncture, and you really have to go to someone that really knows what they're doing and has the right training, because anyone can just put needles anywhere and say that they're doing something, but do we really know?
Yeah.
So putting a laser, it has a little sort of longer or wider range of where you're working, and that user error is diminished.
100%.
So
yeah, the nice thing, like Dr. Ashley in here and Dr. Tanner, they're both certified in acupuncture and have done big programs for that as well. But the nice thing is, like, you can't put a whole bunch of needles in a little kid and expect them to stay there. So like the nice thing about that is a therapeutic strategy you can use for that population that you can't typically do traditional acupuncture with, so as well, which is huge. What are some big things that from the course or from being here the last couple of weeks that you'll start implementing in Canada?
Yeah, I think
maybe in your own exam or maybe in your thought processes, I think would be interesting to talk about. So
I've had a few kids, more recently one comes to mind where a mother, their child has, they were diagnosed with ODD and ADHD, kind of not wanting to, do the traditional route of medication. And my sort of, I see them, I kind of do a little assessment. Yeah, okay. Send them to a pediatrician that kind of takes over, and, or in some cases it might be a pediatric psychiatrist.
Yeah.
But they came back and they weren't sort of satisfied with their consult with them, and
Yeah.
just medication was pushed on them, and that was the only option. And I even sort of counseled them that there are other options in terms of parents getting some help through like psychologists doing some behavioral parenting.
Yeah.
Sometimes it's not even the child; it's how the parenting is.
Oh, for sure.
But resources are limited. They don't have sort of private benefits to go and get that type of help. So I'm hoping to actually get them in and do an assessment and see what kind of primitive reflexes he has.
Yeah.
And actually did talk to them because they had a well-child visit with their other son. So I kind of told them about what I'm coming down here for. And so they were excited that to come back and see me and
Yeah.
see what he has and what we can do for that.
Yeah. What are some of those foundational pieces?
Yeah. Yeah. And interesting too, there was another child I took a new family on, and they have 2 children that are both adopted. And the one child, he was maybe 3 or 4 when he started going to school, and parents were getting phone calls that, hey, you got to come and pick up your kid. They're, misbehaving. They're hitting other children. And the mother was like, this is not my child. I think you got the wrong parent. But no, really, he was sort of acting out and having this, these outbursts and behavior. Their previous family doctor, did the consult to the pediatrician, saw them for 15 minutes, did a, subjective, sort of exam, sort of questionnaire that the parents fill out, teachers fill out, quick diagnosis, medication, off you go. I ended up seeing them and, trying to do an assessment because he was a little difficult in the office.
For sure.
First day meeting me too. And it was his first day of school. So it was a little overwhelming for him. But for some of the testing I did too, kind of testing his eyes and seeing he did have kind of that skipping, no nystagmus, but that skipping kind of
saccadic eye movement.
Yeah. So parents were, even with that minimal exam, they were kind of astonished that, okay, this is what we asked the pediatrician. Like, aren't you going to check his brain? Is there anything else that could be going on that would be responsible for this? And they were sort of grateful for, that minimal exam that I could do on the child at that time, that was more than anyone had done before.
Yeah.
So I'm going to get him back in. The parents are already booked with me to kind of continue on from there and see what comes out of that. But it's interesting that he was totally fine until that 3-4 year time frame, and then something happened. And in his history, I don't think there was any sort of concussions or strep infections or anything that would kind of trigger that. So we'll sort of dive into that and see what else we find out for him.
Yeah, in a lot of those cases, you think of like just looking at their developmental trajectory, like hitting their, army crawling on time, their motor milestones. Like a lot of times those inefficiencies aren't picked up until they get into a scenario that is more stressful than their home. Like school can be more stressful, or first grade or second grade, they start developing reading issues. And these things become more and more evident, like the underlying mechanisms become more and more evident. Like, for example, if you can't track your eyes and focus your eyes, you can't focus your brain. If you can't track a line, you can't read very efficiently. Like, those weaknesses get picked up as the child gets put under more and more stress. And those environments, like a lot of times they don't get noticed prior to, just simply because they weren't under enough stress to bring out those deficits yet. Mm-hmm. But then when you go and look at them, you go, well, yeah, their eyes can't track efficiently at all. Like that's from their cerebellum. If they still have primitive reflexes, those things should have gone away in the first year of life. And now we have true underlying neurological signs of weakness that should be checked in all of these kids, but they're not. They're just, and I could be saying this wrong as well, so correct me if I am, but like ADHD isn't a deficiency in Adderall. There's underlying reasons for it. And if we can figure out what those are, figure out what's going on developmentally, neurologically, figure out what's going on in their gut, figure out what their nutrient statuses are, all of those things, they all build up to a much healthier, better functioning child that can adapt to more stress. And then they can regulate more efficiently. Mm-hmm. So.
Yeah, I think, struggle with our medical system, both in Canada and America, is people want a quick fix.
Yeah.
And sometimes medication provides that, but is that the best solution? Is that the long-term solution? It's not.
Yeah.
So yeah, I mean, it's a good example is a deficiency of Adderall. It's definitely not.
Yeah.
and getting to the root cause is what people really want to do.
Yeah.
But in the medical system, you see so many people, you don't have that much time with them to, do a full exam and kind of get down to the root cause of some of these things. And so a lot of it is left up to the parents to kind of look for alternatives. And
right.
And this is kind of not well known. So
no, it's not.
I think in coming years it definitely will be, and hopefully it'll help a lot of people and kind of help these kids, be able to learn in school without having, medication or having the struggles that hold them back.
Yeah. Yeah. I look at like the overall, like what's the underlying mechanisms for all of these issues. And you talked about, they want a quick fix, but the solution is never a quick fix. It's always a lot of work, to be honest. And it's, they have to put in a lot of work, and they have to, I always tell parents, like, if you want a healthy child, you literally have to swim against the stream of what all of our culture is doing. Because, like, if you look at the foods they're getting at lunch, they're awful. Like, they're just highly processed, carbohydrate, sugar-loaded foods that are going to create blood sugar spikes, and then they're going to drop, and then they're going to have behavioral issues and focus issues. And they're going to parties, and they're getting all the gluten and dairy and all these inflammatory foods that are, seen as quote unquote normal in our societies, but are really long-term affecting overall function. And I think it's important to look at those aspects and help the parent understand it's like, you can choose what battles you want to do. You can choose to have the battle of, no, we're not going to, feed you these things, or we're not going to do these things because this is what society does. Or you can choose to have the battle of dealing with the behavioral issues and dealing with the attentional issues. And it's just kind of like, what battles do you want to face?
Yeah, the struggle is people are very misinformed of what healthy eating is.
Yeah.
And I get it all the time in my office. Someone has prediabetes or their cholesterol is elevated, and they're kind of like, I eat healthy.
Yeah.
It's very convoluted with healthy means,
right?
And people are misguided, and foods are misrepresented as being healthy, and the additives and all that, junk that's in there. It has an effect, and we're told and thought to believe it's not.
Yeah.
And food industry is kind of allowing people, or allowing companies rather, to, let's say natural flavors, artificial flavors. We don't even know what's in there.
Yeah.
It's protected. It's a proprietary ingredient.
Yeah.
So they leave the sort of, the safety monitoring or assessment up to the company putting that in there. So how are you going to trust a company to, put a product out there and say it's safe, and no one else is sort of, safeguarding that?
Yeah, exactly.
And you do have third-party testing that tests some of these things, and we discover, oh my God, this is like formaldehyde is in this product. And okay, it's not enough to kill you, but you consume this every day for 15, 20 years, what's it going to do to you?
Yeah. 100%.
And that's what we don't have the data on.
Yeah. And even like in the United States, it's a big deal. Like we allow something like 10,000 chemicals into our food that, or like the European Union only allows 400 of those. Mm-hmm. And a lot of those are neurotoxic. They're toxic to our gut. They're toxic to our brain. They're just toxic to our body. And, and then you have you're supposed to eat grains and cereals and things like that, which is like the worst recommendation you can give. You look at a kid's diet and they're eating cereal every morning. Like it's the sugar content of that mixed with the milk they're consuming is like nearly what a pop is. Like you wouldn't give a kid a pop for breakfast, but
some people do.
Crazy. But but those things are considered, these are, that's the foundation of our food pyramid, which is like the worst thing you could possibly do for a kid. But like breakfasts that are high in protein and fat have been shown over and over and over and over again to help kids with ADHD have better function because their blood sugar stays stable. Mm-hmm. If you go and hammer a whole bunch of donuts and then you go try to work, like good luck. An hour later, you have brain fog like crazy. You can't focus. You're about to fall asleep. Like that's what you're doing to your kid every day.
And then you're bound to eat more after that.
Yeah, you're bound to binge more on it because it's super addictive.
Yeah.
And
those spikes.
Yeah.
Trigger, you need to recover. And how do you recover? You drink or eat more of that.
Yeah.
So it's a vicious cycle that people get stuck in.
Yeah. And I mean, now, 50-60% of our kids are in the obese category, which is, since that food pyramids came out, it went from like 5 to 10% to almost 50, 60%, which is unreal. But and it just shows like this profound recommendation for this is really unhealthy. And obesity is, this is not like fat shaming or anything like that, but obesity is highly associated with every underlying condition. I mean, it's a metabolic disorder. It's going to affect every area of the body, every area of the brain, it's going to affect everything.
Yeah.
And huge piece of what we need to start with, to be honest.
Mm-hmm. It all boils down to what's subsidized by the government.
Yeah.
And it's, wheat, corn, and soy.
Yeah.
So that's in everything. You look at any label and you don't want to, consume canola oil. You got to look.
Yeah.
It's in everything.
It is.
So it's kind of, it takes work. It takes work to do that. And you have to be really cognizant preparing your meals and thinking ahead and making sure you're sourcing things from the right places. And
yeah.
So it's not easy. It's a convenience diet and going fast food, and even if it's once in a while, it's not going to kill you, but it's going to throw you off if you're used to eating really well.
Yeah, yeah.
You feel it more too.
You do.
Yeah.
I had to be really specific we have a family here from Switzerland this week, and I was like, you can't eat the foods you eat in your country. Like you can't. Like the patient is going to feel horrible here because we have so many additives. We have so much more sugar. I remember when I was in Switzerland, I had a pop there, which I haven't had a pop in years. It had it was really low. I don't remember what it was. It was like 12 grams of sugar. And I was like, the same pop in the United States is like 30. It's just insane.
What's wild is these companies will ship their products to Europe and the ingredients are completely different.
Yeah.
And it's the same product.
Yeah.
Why don't they just sell that here too?
Yeah.
Why are there all these additives? Here. Yeah. Why are they added in?
Yep.
It's unnecessary.
It is, but it looks like, for example, with cereals, like if you look at Fruit Loops in the United States, and then they have dyes in them, but even in Canada they don't have dyes. They're naturally flavored with or naturally colored with like different actual fruits. But they look more appealing. Kids eat more of them. They have a higher sugar content. McDonald's fries in the European Union, like we have in the United States, we have something like 11 ingredients in them, and probably not even potatoes, probably plastic. But the side note is in Europe, there's like 3 ingredients, and salt is you can choose if you want it or not. Like it's completely different product there.
Yeah.
And which is unreal because that's horrible. Like in a lot of the ingredient, the reason why is a lot of the ingredients in the United States are banned in other countries because they've been shown over and over again to be unhealthy or cause cancer or cause be neurotoxic or toxic to our liver or kidneys. But in the United States, they're not regulated. So
yeah, and that's where I feel it's lost amongst doctors. We don't get trained in nutrition, and even if we did, is it the proper nutrition?
Yeah,
right. Like even some dietitians, the stuff that they're telling people is not correct.
No,
and it might help in some aspects, or it might serve some people, but what are you picking from that's on the shelf, right? And people are still consuming that, and that's the underlying thing.
Yep.
So whole foods, plant-based diet with good quality meat.
Yep.
Staying away from processed foods. That's what I try and tell everybody.
Yeah.
But some people can't do that. And that's where, with medicine, it's either you make those changes. If you can't, there is medicine that is going to sort of help prolong your life.
Yeah.
If you have hypertension
and some of the symptoms,
you're not making changes to reduce that, then you need medication because your heart's going to remodel and you're going to have problems like AFib and have a stroke and die.
Yeah.
And that's years down the line, but
yep.
That's what we're, trying to protect in terms of people, but
right.
Trying to get exercise and diet changes, and some, really turn it around. It's like a life, eye-opening experience to get diagnosed with diabetes. And I've seen some people completely reverse it with diet.
Yeah.
Some people, they don't have the means to do that either physically or financially, and then they need medication to sustain their life. But
right.
But if we were to not subsidize those things that predispose people to that and they had healthier options to choose from, then, we might not need medication as much.
Yeah. And hopefully that's a political change that happens very soon, because or else we're just going to get sicker and sicker and sicker. And that's, which is kind of wild, but those things should be changed. Those things should be subsidized. Healthy things should be subsidized. Stuff that, yes, it's more expensive for sure, but it also has nutrients in it. Like, we're in the United States, we're the most obese country with the highest rates of malnutrition. Because all the food makes us fat, but doesn't give us any nutrients. So all these kids I see it in kids, a lot of them are overweight. They have no nutrients. They feel awful. They have tons of calories on them, but it doesn't convert to energy because they don't have any nutrients in their body or minerals that we need to do that. And it's because the source of where that food is coming from is just, it's calorie dense, but very nutrient poor. And if we can reverse that and get, people start making changes on, subsidizing nutrient dense foods instead of calorie dense foods, now we have a solution that's going to help every person in this country, that especially ones that can't afford appropriate foods, to be honest. But then I look at there is a lot of options that maybe people don't even know about. And for example, rice and beans, they're cheap. They have both those together. They have all essential amino acids. So they have enough protein, they have a decent amount of fat, then you get some, some other just ground beef on top of it, and, or make different soups and things like that. You can, I remember in college, I wanted to go on spring break once. I lived off a soup for 2 months straight, and it cost me $10 a week. So there's definitely ways if you want to figure it out, if, you have a reason to do it. So and is it going to be as great as, all organic and, all that type of stuff? No, but it's going to be a lot better than highly processed foods that are just full of pesticides and no nutrients at all.
Yeah.
So.
Yeah, well, hopefully those changes are made. I think people are opening their eyes a little more, and there's a lot more talk about it, and people choosing the right products. And, we vote with our mouths and our money every day. So we just got to make the right choices.
Yeah, I was listening to the RFK roundtable, and one thing the guy said in there is a lot of these huge companies, these food companies, they don't have a huge margin. If overnight, they have a 5% decrease in profitability, it's going to put them under, to be honest. And so just like you said, we vote with our mouth and our money. If we change what we're voting with, those things are going to change, because they won't have any profitability, so they have to change. So that it was a good point, I thought, in there, because, and if anyone is watching this and hasn't watched that, it's a 4-hour roundtable. It's really, really informative. It's really good. If you look it up on YouTube, it's there. So anyways, watch that. Super good. This video is sponsored by Unraveling the Brain, which is actually my course to train doctors to help these kids in the way that we do. So if you guys know anyone and know any doctors that are in your area that are maybe interested in working with kids, go ahead and send them a link to limitlessfoundation.co, so that way I can help train them, so you guys have a provider close to you guys. Let's jump to the show. Canada is obviously way different healthcare than here.
What do you have questions or things that you
want? I just think it's interesting, they can't private pay, they can't do that type of stuff, which is super interesting to me.
Yeah.
But I don't know.
So the Ontario government is sort of getting criticized a little bit, that they're trying to move in that direction.
Yeah.
I guess the most recent thing is the way our hospital systems work. If you want a knee surgery, knee replacement, hip replacement, that sort of thing, the hospital gets that funding from the government. Then the hospital pays their surgeon to do that surgery. And they limit how many, let's say 40 knees you can do in a year. Once they reach that quota, that surgeon can't operate on knees until the year rolls over and they can get funding again. With COVID, there was a big backlog. So the government looked at, hey, can we sort of pay in terms of clinics privately to, have a little surgical suite and do the surgery there as opposed to in the hospital. So that was kind of the start to, is that kind of looking at, we're going into more of a private kind of care system, and Canadians don't want to do that because, there's this entitlement that we have that, our healthcare is free and that it should continue to be that way. And I think in a lot of countries, there's a dual system that can work. And I think, we need to explore that option because like our healthcare system in Ontario is failing and doctors are getting burnt out, and, we struggle with kind of coordinating care and, struggle with our contract with the government. It's getting harder and harder to have your own practice and sustain it as a business and pay your, employees appropriately, give them, proper coverage for their, private benefits or retirement plans. It's more than, what you would have gotten into medicine for. So a lot of people are not going into primary care. So this year, our residency match for family medicine, the first iteration, 50% of the spots went unmatched. That's really never happened before. Yeah. So a lot of students are looking at other specialties. So second iteration, because it's obviously not everyone can go into, those really sought after specialties. So they didn't get in. So then they go and fall for family medicine again. Yeah. With family medicine, there are other things you can do within that specialty. You can do like a fellowship after and do sports medicine. You can do anesthesiology. You can, deliver babies, be an obstetrician. So there's a lot of other avenues, even dermatology. So a lot more people are going to go in that direction, and primary care is going to fall short. And less and less people are going to have a family doctor. And, the alarm bell for this has been going off for at least 10 to 15 years as a result of some decisions the government made back in late 1990s, early 2000s on funding. Yeah. So that's, we're feeling that now, and it's just going to get worse unless they come up with a real solution. Right.
And, we see a lot of patients from Canada, which is really interesting, but and even a lot of the providers I talk to that, maybe they take my course, but they may not even be able to implement a lot of these things. 2 points here. The first one is like, I've seen patients like, man, you need an MRI like now. And they're like, oh yeah, well I can get one in 6 months. And I'm like, well, you need it now. Yeah. And so they come to the States to go to a private clinic where they pay, $1,000 or a couple $1,000 and get an MRI. And which I think is really interesting. But then even just like talking with providers, like, hey, I want to implement this, but I actually don't know how I'm going to do it because they can't private pay and we can't do these services in our clinic because of regulations, and we can't private pay. So there's really not a way to do it, which I thought was, like, in the scenario that you're in is I was like, oh man, that's really interesting.
Private pay is you can't charge a patient for something that's covered by OHIP. So it's the Ontario Health Insurance Plan. Yeah. So that's where, the stipulation is. So you can charge them for things that's not covered, like, for example, Botox treatment for migraine. So I offer that to my patients. It's not covered by OHIP. So patient can get their private insurance to pay for the medication, but there's an injection fee. So they have to pay me for that. Yeah. It's not covered under OHIP, so I can't bill the government for that. So that's kind of a workaround in that sense of there's still private things. Other things, for example, is even getting warts treated on your hands. It's not covered. It's covered on the feet or the genitals. So if I have a patient coming in, they want it done on their hands, I'm supposed to charge them for it. Yeah. I can't bill the government. Right. Which I think is ridiculous. It's like it's on your hands.
Same thing.
What's the difference that it's on your feet? You got to spread it around anyways. So it's kind of wild that they have these stipulations. So, but yeah, in terms of doing something like you're doing, it's not covered. It's not something that OHIP offers. So I think there is avenues for that. It's just how much can we do? Yeah. There's the governmental or governing bodies that are different that are going to have their sort of stipulations on what can and can't be done. But because I've had a lot of parents be like, hey, you basically like, can we open an office in Canada? And I was, I don't know. Like, it's uncharted territory. So, we'll see. Yeah, see what happens, but definitely interested in exploring that. So
Yeah. So now learning what you've learned through our courses, and you've seen how we work with kids here, and like seeing both sides of this whole map. If you could build something in Canada, how do you see that working? Like, what would you do? What would be routes to do that? Like, and maybe that's for kids with ADHD, maybe it's for kids with autism, maybe it's for kids with learning disabilities, and in those types of scenarios, there's a lot of these brain-based issues that are going on that we don't have, a lot of solutions for, and are only getting worse. How would you see that happening in Canada?
So, I mean, I think you have a great model. I think to work off that is definitely something we can implement in there. It's just a matter of, will people that have this mindset of this should be free, this should be covered, and it's not, still come in and, see a provider and pay out of pocket for that? Because there is PT and OT that you guys utilize that, need to be involved. So there is billing that private insurance can be done for that.
Yeah.
It's just a matter of if you have, either a chiro or an MD doing that, how are they sort of reimbursed?
Yeah.
Chiro might be able to bill in their sort of model. And then it's just a matter of the MD. We can't bill OHIP for that. So, are people going to be willing to sort of pay out of pocket?
Yeah.
And how much, do you sort of kind of charge in that sense that will be a benefit or be acceptable to people?
Right.
And versus what you get from the insurance anyways, right?
Yeah.
Because this is kind of a little more above and beyond of what you would learn in school. So, there's, your expertise should be sort of compensated in that regard.
Right.
So people need to see value in it. If people see results and that word spreads and your online Instagram account kind of, shows that. Yeah. And people's, word of mouth and sort of, talking online and sharing their experiences with their children, and those are testimonials, and they're seeing results and sharing that. Other people want those results for their children, and as a father, I think you're going to do anything for your kid, and if it's something that other people are saying this has helped my child, you're going to try it. And I really like your philosophy too. You're not claiming to cure this or cure that. You want these kids' brains to develop. These are primitive reflexes that should have gone. Let's get rid of them and let their brain kind of take over and work on healing and sort of developing. Yeah. And where that takes that child, it depends. But you're going to at least give them a better shot than they would have had. Right. Those retained. So
we truly believe God heals. We're just trying to put some resources in there to help that happen a little bit more efficiently as well as we can, and using things that just have a massive amount of research behind them that have shown to do that over and over and over again. They're easily implementable. So it's huge, and the difference there is and I don't know how this would work within Canada, but for example, in the United States, a lot of OT clinics are going to private pay only because of the reimbursement is so poor. I was talking to one where they do a kind of intensives similar to what we do, but for an hour, the max they can charge to an insurance is $115. Well, by the time you take that means you can literally pay the OT that might have a doctorate $30 to $40 an hour. What doctorate level OT is going to work for $30 to $40 an hour? That they've taken on hundreds of thousands of dollars in school loans, and I just can't afford to do that. And so a lot of those ones that are taking insurance are going under, even though they have massive amounts of clients. They're going under because they literally cannot afford to pay. And you might be thinking to yourself, oh, well, now if they're getting paid $40, there's a difference of, $75 there. Well, no, you have rent on top of that. You have staff on top of that. You have people to help keep the office organized, clean. You have management. There's not room in there. You have to have a decent margin to be able to pay all those people. Yeah. And so they can't afford to do it. And I'm wondering what that reimbursement looks like in Canada in comparison to here, because that's why we don't take insurance, is because let's say we go submit a bill for, however much care and it's $2,000, they come back and go, okay, we'll give you $900. Like, well, that didn't even cover my costs. Like, awesome.
Yeah. And that's definitely what I saw in Detroit. We didn't in residency see all that much billing, but we were kind of told, oh yeah, you're going to charge the insurance this amount, but you're only going to get back like 50%.
Yeah.
Like, what?
Yeah.
That's ridiculous.
Uh-huh.
And I think too, people, especially, in Canada, they don't understand the overhead and all to keep the lights on, to keep the doors open and cleaning and equipment. So we just opened up a new 30,000 square foot building, where we occupy the whole second floor of that. So like 10,000 square feet.
Yep.
And, we just had to go through, buying all new equipment. Like you should have seen the old exam tables we had in this previous building. They were out of wood, pushed against the wall, thin foam that you lay on. Now we have real exam tables, but all that costs money. So, it's like we see that we're paying the price so that one, we're in a more comfortable setting and it's a little more, technology advanced. We have like a system that you come in, you check in at a kiosk, you sit down in the waiting room, your name gets called on the PA and you're told what room to go into. You go and sit down and then the doctor or the nurse comes in to kind of see and do, vitals and whatnot. Yeah. So we're paying a little more for that type of efficiency. Hopefully it pays off in the end, which I think it will. But people don't see that as like, oh wow, like you guys are, taking a hit on that as well. Yeah. It's not like the government's giving us extra money for that specifically. Right. So they don't see that, and they see and even like specialists have like they publicize how much people make as doctors, and you see this large amount. For example, ophthalmologists can make a really nice income, but you're not told how much is their overhead. All the fancy equipment that they have to do what they need to do, that costs a lot of money, and to maintain it and upkeep and all that. How much they're taking home is still decent for them, but it's not that number, and everyone holds on to that number and thinks, oh, you guys just want more money because, look how much you're already making. How much more do you want? But it's not about that. It's inflation and trying to keep up with those costs to kind of keep your, lifestyle and providing for your family and your children. So
even just doing like a build out, like to build a building or build out a space, like if you already have a shell, even it's $160 a square foot to build out. Like that's when you're building out 10,000 square feet, that's $1.6 million, and then you have that's just to get the space that you got to pay for long term, like with a loan, which is not cheap by any means, and then your monthly on that isn't cheap. And then you have, on top of that, you have all your equipment, which, in here we have $400,000 in lasers. Like, and that's just lasers. We have all these other fancy equipment. It's like, we have $1 million worth of equipment that it's, which I know you guys do too, is, all those things, they cost a lot, and then you have lawyer fees on top of it, and you have all these other things that you don't even think about and then you're, when you use credit card billing and stuff like that, they take percentages. And there's so many little things that I would have never thought of when I opened up of like, where did all that money go? Oh, it went to this and this and this and this and this and this and this. Like, we need that. We need that. We need that. We can't run the business without that. And it's kind of wild how much goes out versus, what comes in is, it looks like a big number, but how much goes out is, especially as the business gets bigger, it just gets to be a much bigger number. It's wild.
Yeah. We, on the sort of building side of, that being a business owner and kind of property owner, we saw just all the background stuff on owning a building and the lawyer fees and getting the mortgage set up. And we had to pay
costs and all that. We had
to pay lawyer fees, the bank side and our side. I'm like, what? Why are we paying the bank side? They're getting a great deal here. We came into some hurdles there and paid a hefty number for that and mortgage.
Yeah. Just to close the loan is
and couldn't believe that number. But
I know
it's over. We're moving forward, and hoping for the best there, but
yeah, for sure. I think those are fun to talk about because even just like business owners that are watching this or like people that want to open a clinic, it's those little things add up. But.
Yeah. And I mean, when I came across your course, personal side of things, like I wanted to know these things because I thought maybe it can help my daughter.
Right.
So she had a bit of a tough start and, doing some of these primitive reflexes, she still has some retained. So they're definitely hindering her further development. So like when I was looking at your course, I was like, oh, he's got all these topics on business. And I was thinking back then, well, I'm not going to be able to implement this or do this in Canada. But I still took the course just for the knowledge, but taking the course and kind of getting that business sort of aspect that you share on there and the knowledge is really good to kind of know and inspired me to say, hey, I think I can do this. So that's where I think I'm going to hopefully be able to move forward and not have too many roadblocks or hurdles in Canada. But
hopefully we can get a clinic up there started. Just, even if it's people still, if they want to come down here, awesome. But the place to go to in between too, just, helping with rehab and keep working on that development. Because like for a lot of these kids, this is not it's 100%, it's not a quick fix. Like they don't come here and they're magically better in a week. Like we're just working on starting a developmental process that's going to last a year or two in a lot of cases with a lot of work at home. But if they have therapists at home that can help them reinforce that and keep that development going, I mean, that's huge. Like that's the goal of opening the other clinics that we're starting is that people, will still come here to get an intensive, but now we have a resource locally for them as our goal is we have a resource locally that we can say, hey, go here. They're following the same sequences. They know what we're doing, why we're doing it, the philosophy behind it, and they can reinforce that. And if they want to come back for another one, great. Or maybe they don't ever need to. That's kind of our goal is that we can try to get this spread everywhere because it is so beneficial for kids. And I don't know of other systems like that, to be honest, that work as well. Like in our system isn't by no means is 100% perfect, but we're just trying to develop it every day. We're trying to get a little better every day, make a better system. So, I mean, if I look back 3 years ago, I wouldn't do any of the same things I did 3 years ago, even though 3 years ago we got great results, but it's not like we get now. And I'm hoping in 5 years it looks completely different and we get way better results then.
And the cool thing too is like you guys teach each other and share different, it's like continuing medical education. You're constantly learning and you guys are constantly sharing and, hey, this is what helped. And it's like you guys kind of do some like grand rounds where you share cases and constantly are learning. And I think that's going to propel you forward and something new comes out. Hey, I heard about this and implement that and see if it works. And so, it's not, your learning isn't done. And
100%.
So it's,
I used to say it was really interesting. When we first started out, and the reason why that's implemented in this business so much is because when I first started out, it's wild. I would learn something and our practice would grow. And then if I like took a month off and didn't learn, our practice would just like slowly diminish. And then I started getting worried about finances. Like, oh my gosh, we got to make it. And then I'd go learn something and I'd be able to help a whole new population that I wasn't able to help, a month ago. And the practice would grow again. And it got to the point where when we'd start slowing down in business, my wife would be like, you got to go learn something. And it's so now, we pay our employees to learn like 5 hours a week. So, and then they teach the rest of the staff what they learned. And, like even yesterday, we have Monday meetings where we, like Dr. Ryan, he taught about PNF and how we can implement those approaches into the therapies that we're already doing and to get better results. And it's been really cool bringing in different providers that they all learn functional neurology, but they all look at it through a different lens and bring in their own unique things that they've already learned into that, which is, it's huge. It just like, if it was the same as it was 3 years ago, it would be nowhere near where it is now just because we brought in all those providers that can bring in those perspectives. Yeah,
it's a good diverse group, I think. And, and everyone's, really happy with the work that they're doing and, they're inspired and striving to learn more. And that's what you need in a, work environment. And
you do,
keeping up with research and cutting edge. And
Yeah, for sure. Hopefully we can keep developing that.
Yeah. So your course, extremely beneficial. It's kind of a roadmap for any provider that's, looking to expand their practice, and great step-by-step, videos and information on how to do that. And I think that, learning about the primitive reflexes, if you already have some base knowledge in that, this kind of takes it to the next level on how to actually, clinically implement it. And then the whole piece on business, what you might need to know that you may have not thought of. So it's always good to learn from people that have been there and kind of blaze the trail before you. So you're learning from their mistakes and, not having to have those setbacks that maybe they had. So I think you kind of share a lot of experience and expertise on this field and doing what you're doing. It's extremely successful. So, it's, and the great thing too about, you and your course is that you're not only helping kids and their families, but you're helping providers, expand what you're doing. So you're going to have greater reach that way. And it's really inspirational and admiring, and we're grateful for what you've done and what you're going to continue to do, and
thanks, man.
How motivated you are to kind of keep moving forward. And I'm excited to see the 2 other clinics that you're going to open up and see where the future takes you.
Yeah. Thanks, man. Well, I appreciate it. I appreciate you being on this. This is going to be good for just general information, but also for just providers to see how an MD can work with a chiro and how we can all work together to help these kids.
Exactly. And that was one thing too, is in the course I was like, oh, it's kind of geared towards chiros, but it is and it isn't. And I asked some questions too. Well, how can I do this if I can't do adjustments, or I can't, and you gave me good options for that. And working together as, providers, we're all striving for the same thing, and that's helping other people, and knowing that one sort of plan doesn't fit everybody. It's not a one fit all system, and different people benefit in different ways. And that's why people go and see naturopaths and chiropractors, osteopaths. We all got to work together because, the end goal is helping that patient. And and that's what we do. So
yeah, 100% for sure. Thanks for your time, man.
Yeah, thank you for having me on. It's been a pleasure.
Awesome.